Support for this podcast comes from the Central Valley Journalism Collaborative, connecting communities with the resources, infrastructure, and networks to ensure a vibrant local free press.
From KVPR in Fresno, this is Central Valley Daily. Happy St. Patrick's Day. Hope you're wearing green. It's Monday, March 17th. I'm Elizabeth Arkalian. Measles cases have been slowly growing in the U.S.
The problem is when a person who has measles lands in a community that is really under-vaccinated.
In just a few minutes, we'll get a sense of why these cases are showing up and how we can stay protected. But first, these news headlines. The former CEOs of Bitwise Industries are reporting to prison tomorrow. Jake Soberall and Irma Olguin Jr. were sentenced in December after pleading guilty to fraud while leading their tech startup company. Soberall was ordered to serve 11 years, while Olguin Jr. will serve 9 years. Both will pay millions in restitution. The Fresno Bee reports Soberall will turn himself in at a prison in Lompoc, and Olguin Jr. will serve time at a prison in Victorville. Bitwise's downfall nearly 2 years ago left hundreds without jobs in at least 5 states. State Farm customers in California could see their insurance rates surge by more than 20% starting in June. The company is the biggest provider of homeowners insurance in the state. Levi Sumagaisai with our California newsroom partner Cal Matters has more.
State Farm asked for emergency rate increases after devastating fires hit Los Angeles County earlier this year. Now, Insurance Commissioner Ricardo Lara says he'll agree to the hikes, but only if the company wins approval at a public rate hearing next month and agrees to certain conditions. As part of those conditions, Lara has asked State Farm to refrain from canceling or not renewing policies through the end of the year. State Farm would be the first insurer in California to get approval for emergency rate hikes. Rates could climb an average 22% for homeowners and 15% for renters and condos. If the hikes go through, they'll be effective on June 1st.
That's Cal Matters' Levi Sumagaisai. A nationwide boycott against Tesla and its billionaire owner Elon Musk made its way to Fresno this weekend. Protesters gathered at a Tesla showroom in North Fresno on Saturday to protest recent actions by Musk. Specifically, protesters are upset with Musk's work on the Department of Government Efficiency, or DOGE, which has led to job cuts across the federal government. Demonstrators also voiced anger at Musk's influence over the Republican-controlled White House and Congress. U.S. Congressman Ro Khanna represents the Silicon Valley, but he's planning to hold a town hall for voters on Sunday in Bakersfield. That's the home turf of Republican Vince Fong. Khanna is a Democrat and says Fong is refusing to meet with constituents who are critical of President Donald Trump and potential cuts to Medicaid. Fong replaced Kevin McCarthy in Congress last May. An ordinance to rein in smoke shops in Fresno failed last week in a tie vote by the Fresno City Council. As KVPR's Joshua Yeager reports, that means the city's 140 smoke shops will continue operating largely unregulated.
Exactly how to limit the number of smoke shops was the sticking point for council members who opposed the ordinance. The ordinance would have allowed for 49 shops and forced dozens more to close over the next few months. Todd Weinkamps is an attorney representing the California Smoke Shops Association.
You are going to immediately shut down at least 30 shops.
Weinkamps told a packed room that making those stores close would violate shop owners' constitutional rights. City staff disagrees and says the store owners could apply for an operating license. Supporters say the ordinance is necessary to close smoke shops near schools and other sensitive areas. The council suggested it would be open to a new ordinance and asked city staff to look into it. For KVPR News, I'm Joshua Yeager.
If public radio didn't already exist, we'd need to invent it. Do you really trust a billionaire to deliver your news? What about a hedge fund? Or AI with its hallucinations? Public radio is great because the listener comes first, not profit. Help keep the freely accessible information on KVPR, free with your donation today. Become a monthly member at kvpr.org/donate. And thanks.
And now to our main story. Measles is a viral infection that can have serious effects on people. It's also preventable by a childhood vaccine. But cases in the U.S. have been growing recently. Out of multiple outbreaks, the most significant number of cases are in West Texas. And just last week, one case was confirmed in Fresno County. There's not been a case of measles in Fresno County in 2 years. And the person infected in this case may have exposed people in nearby Madera County. So how concerned should we be about measles right now? To give us an idea of the current risks, KVPR's associate editor, Carrie Klein, spoke with Amy Maxmen. She's the national public health correspondent for KFF Health News. Carrie starts out this conversation for us.
And so tell us, what does the virus look like? How does it present in people?
So about a week or two after you might be exposed to measles, you might have a high fever, a cough. Then you can get these tiny white spots inside of the mouth. The next thing that would happen is the classic measles rash, and that looks like red spots, flat or maybe a little bit raised, that might start on the face and then spread downward along somebody's bodies and limbs. A lot of people have a fever that can be quite high.
Right. And so a lot of folks may think, what's the big deal about a fever and a rash? And that might be the majority of cases, but it really can be much more dire than that as well.
Yeah, that's sort of the trick. Like so many diseases, it presents differently in different people. So about 1 in 5 people with the measles are hospitalized, and 1 in 10 children who get measles get ear infections, and that can even lead to permanent hearing loss. Roughly 1 in 1,000 children die, but that's a rough estimate. We've already seen some deaths in the U.S. this year.
Right.
The other thing that's kind of a weird, newer research has found that measles infections, which is bizarre, can sort of erase some prior immunity to other viruses. So it can erase sort of some standing immunity to like the seasonal flu, which makes flu cases even worse after you've had measles. And then kind of like a final impact that makes measles bad, even though, like you said, okay, what about those 4 out of 5 that aren't hospitalized? The other problem is that it spreads so fast, it's just so contagious that then it can spread to other people, say in somebody's family, who either aren't vaccinated, like infants, or who can't be vaccinated, or who just didn't respond very well to the vaccine.
So measles is preventable. And across the U.S., most people have received the vaccine. What is the current vaccination protocol for measles?
The CDC says that babies should be vaccinated, get the first dose against the measles. That's actually the measles, mumps, and rubella vaccine, the MMR vaccine. They should get that between 12 and 15 months old. And then a second dose when they're between 4 to 6 years old. These are kind of well-timed before the start of like preschool and school, because that's when you have lots of kids together and they're able to spread things between them really quickly. And in the US, the average rates of vaccination among kindergartners is around 93% now. Now, that's not terrible. We're aiming for above 95%. That's when you know you have really strong protection in a community. 93 is still pretty good, but that's a lot lower actually than it's been for a long time, for about a decade. It's been really on the decline since 2019. Back in 2019, we were like around 95% or a little bit over. The other thing about the 93 number means like we're going down in the US overall, but what that hides is that the number is brought down by specific pockets of the country where vaccine rates are actually really low.
So if someone does get measles, what does the treatment look like? What's the prognosis?
So there's not a simple treatment. There's not like a measles drug. So if you think that you have measles, if you see that characteristic rash and there's a chance, especially if there's a trans who are exposed, the next move is to get tested. And then the doctor should decide what to do. And that could be antibiotics, because sometimes measles leads to a secondary infection where a lot of kids will get pneumonia later. But not everybody should get antibiotics, so you don't want to do that. Sometimes they might suggest steroids, but not everybody should get steroids. So that's why it's one of those things where you want to consult a doctor about it.
In Fresno County last week, we had our first detected case of measles in 2 years. You've recently been doing a lot of reporting on a really big outbreak in Texas. So what is causing all of this right now?
So it's not completely abnormal to have cases pop up here and there. An outbreak is officially if it's 3 cases or more. So it's not unusual to have kind of 1, 2 people infected somewhere. That is almost always when somebody returns from another country where maybe there's higher rates of measles, and almost always it's a person who wasn't vaccinated. And so they got this abroad and they come home. Now, the saving grace is that by having these high rates of vaccination like this, like I was saying, above 95% vaccination in communities, that means it sort of stops there. That person gets sick, hopefully they get treatment, they recover, and we're done. The problem is when a person who has measles lands in a community that is really under-vaccinated. And so that's sort of the reason I started covering this outbreak in West Texas about a month ago, is that when I first heard about it, there were still, fewer than 20 cases. But talking with health officials there, they were really nervous because they had these 2 people that were hospitalized. They probably got measles abroad. They were unvaccinated, but they knew that the rates of vaccination in the county where this was happening, in Gaines, Texas, were extremely low. There were some schools with less than 50% vaccination rates, and that's not even accounting the schools where people were homeschooled. It was a religious community, or is a religious community, where there's a lot of homeschooled people who have very low rates of vaccination. So that's where the thing really takes off. And at this point, I think the latest numbers are there's 259 cases, 34 people have been hospitalized, and we've had 1 6-year-old girl has died. And that outbreak's also spread to New Mexico, where there's been another death. And it seems like it's spread to Oklahoma, and it might have possibly even spread to Mexico. We're still waiting to confirm that.
Okay, so where do things stand now? What are government agencies and health experts, health practitioners doing to contain this virus?
So I can tell you in West Texas, it's a ton of work. And I think a lot of people don't notice that either. We measure measles maybe in the number of cases or the number of deaths, but it takes so much work. So the health departments I've talked to in West Texas, they're having to take people away from other jobs that they do to help out with this. They're doing a number of things. Like one thing they want to do is try and get as many people tested for measles as they can, especially kids. So they'll have, mobile testing offered outside of schools, because the idea is, again, even if the child isn't severely sick, they want to be able to treat them, but also isolate them and keep that disease from spreading. So they're holding that kind of clinics. They have to do a lot of contact tracing. So measles can stay in the air for up to 2 hours. And so what they want to do is, let's say there's somebody who goes to an emergency room because they're sick, and then later we find out they had measles. They have to figure out everyone who was in the emergency room for that 2-hour period, find them, find out if they were vaccinated, see if they can get them tested. And the other thing they want to do is hold vaccination clinics, because if you were not vaccinated, your child wasn't vaccinated, the best thing to do is just get a vaccine as soon as you can, because that, if you get one, right after you're exposed, that can actually even lessen the chance of coming down with the disease. Kind of the good news I heard from one of the health officials there, Catherine Wells, she's in Lubbock, Texas. She told me that she's had parents who didn't get their kids vaccinated, especially parents who just assumed, measles is rare, this isn't really going to be a problem. She's actually managed to convince some parents to vaccinate their kids. So that's the main chore that they're doing now.
That was KVPR's Carrie Klein speaking with Amy Maxmen. She's the National Public Health Correspondent for KFF Health News. And that's today's show. Have a story idea or feedback on today's show? Don't be afraid to reach out. Just email us at podcast@kvpr.org. Today's episode was produced by Jonathan Linden and KVPR with support from the Central Valley Journalism Collaborative. I'm Elizabeth Arkalian. Find the latest local news anytime at kvpr.org.
Each morning, it's a new opportunity, a chance to start fresh. Up First from NPR makes each morning an opportunity to learn and to understand. Choose to join the world every morning with Up First, a podcast that hands you everything going on across the globe and down the street, all in 15 minutes or less. Start your day informed and anew with Up First by subscribing wherever you get your podcasts.